Assalamualaikum and good day everyone. I'm Umi.
Hello, I'm Yazwan.
Hi, I'm Prasan.
We are from Group C. Our beloved supervisor is Prof. Dr. Asma Abdullah. Today we are going to talk about acute labyrinthitis. What is labyrinthitis? It is an inflammation in part of inner ear that is called as labyrinth with hallmark symptoms of vertigo, tinnitus, and hearing loss. Today we are going to focus on acute stage of labyrinthitis, which the onset occurs within 2 weeks. Labyrinth is the innermost part of the ear. It contains two important parts, which are the cochlea and the vestibular organs. The vestibular organs consist of three semicircular canals, ventricle, and saccule. There are two functions of labyrinth, which are the first one is for hearing, carried out by cochlea, and the second one is for body balance, carried out by vestibular organs. Below are the etiology for labyrinthitis. The most common causes is by viral infection.
Type of labyrinthitis. First is circumscribed, second diffuse serous, and last but not least diffuse suppurative labyrinthitis.
Circumscribed labyrinthitis is a thinning or erosion of bony capsule of labyrinth, commonly occur at the lateral semicircular canal. The causes are chronic suppurative otitis media with cholesteatoma, neoplasm of middle ear, or surgical or accidental trauma to labyrinth. Transient vertigo is the common clinical features occur in circumscribed labyrinthitis. Diagnosis for circumscribed labyrinthitis can be done by fistula test, either by applying pressure on tragus or via Sneckel's speculum. The treatment are by monitoring vital signs and treat accordingly by systemic antibiotic therapy or by doing mastoid exploration for chronic otitis media with cholesteatoma.
Diffuse serous labyrinthitis. It is reversible if treated early. Causes: circumscribed labyrinthitis plus chronic middle ear suppuration or cholesteatoma, acute infections of middle ear cleft, and mastoiditis ear surgery such as stapedectomy. Clinical features for it: vertigo, nausea, vomiting, nystagmus, hearing loss. Treatment for it can be divided into two: for conservative such as pus culture and sensitivity, antibiotic and labyrinthine sedative. For surgical, the main intervention is mastoidectomy.
Next is diffuse suppurative labyrinthitis. It involves pyogenic infection of the labyrinth, and the causes would be pyogenic organisms and also as circumscribed causes. The roots of infection can be tympanogenic, example otitis media, second meningogenic, meningitis, and third hematogenic from systemic infections. The clinical features would be vertigo, nausea, vomiting, nystagmus and toxic appearance, othalgia, otorrhea, and severe hearing loss. We would perform common hearing assessments such as Weber and Rinne test, pure tone audiometry, and tympanometry. As for infants and children, we perform otoacoustic emission and brainstem evoke response, and with HRCT.
Complications such as permanent imbalance, permanent hearing loss, intracranial complications such as meningitis and intracranial abscess.
In conclusion, labyrinthitis is an inflammatory condition of the otic capsule, often result from a viral infection of the eighth cranial nerve or labyrinth itself. The symptoms may start suddenly and go away in a few weeks. Treatment is typically symptomatic and primarily involves the use of vestibular suppressants. If the symptoms don't go away, patient may need rehab exercises to help the brain adjust to the vestibular imbalance. And in rare cases, this condition can cause permanent hearing loss and ongoing vertigo.
Take-home messages. Most common cause of acute labyrinthitis is viral, and the hallmark symptoms are vertigo, tinnitus, and hearing loss. Diagnosis is supported by history, PE, and also clinical investigations. Thank you for lending us your ears, and see you soon.
Bye.